Hello guys, good afternoon. This is Professor Henderson again, coming to you with a simple certified nursing assistant test questions. So these questions are meant to mimic the Prometric state board examination. So I hope these questions can help you to pass your state board exam to become a certified nursing assistant. So once again, I want to thank those people that have been subscribing to my YouTube channel. Thank you so much for your support and your cooperation, and continue to like and share these videos and continue to subscribe to the channel. Thank you so much. So the first question we have here is that what care should be given to a patient who is approaching death? So we know patients that are terminally ill, patients that have cancer or advanced HIV, our main goal is to promote comfort for that patient. So B is the correct answer. Question 2, a patient with dementia may repeat the same words over and over. What should the nurse's aide do? So the correct answer involves the patient in activities. A, B, repeat the words back to the patient. C, isolate the resident, apply mechanical restraints. We cannot apply mechanical restraints on a resident. That requires a doctor's order, and we follow doctor's order. And as a nursing assistant, that's outside the scope of practice. So the correct answer will be involve the patient in activities so you can distract the client. Question 3, what is true about routine weighing a patient? The correct answer for this question is A, to determine adequate nutrition. That's the correct answer. Question 4, when cleaning a resident denture, the sink should be lined with a barrier to prevent A, breakage of the denture, B, prevent contamination, C, line the denture with paper towel, D, wash the denture with hot water. So the correct answer is A, as in alpha. So dentures are very expensive, guys. So the main goal by placing a towel on the sink, in the event the denture falls, you have something to cushion the denture. So if it breaks, denture is about $3,000-$4,000. So you want to protect your patient's property. Question 5, a patient has wandered away from the unit. When bringing the patient back, what should the nursing assistant say to the patient? How nice to take a walk with you is the correct answer. Question 6, what items should be placed on the overbed table? So emesis basin, B, bedpan, C, urinal, D, fracture pan. So the correct answer is A, as in alpha, and emesis basin. We never want to place a urinal or a bedpan on the overbed table because that's breaking infection control. Question 7, before shaving a male resident, the nursing assistant should do what first? This is a priority question. So the correct answer, wet the resident beard using a warm washcloth to provide some kind of moisten the beard before you shave the patient. So the correct answer is A, as in alpha. Question 8, which of the following found on a patient plan of care? A, assistance with ambulation. B, what medication resident is taking. C, allergies. D, diagnosis. So the correct answer will be ambulation, assistance with ambulation. You can find that on the plan of care because that's what we do as nursing assistants. We help patients to ambulate using an assistive device such as a walker or a cane. Question 9, when caring for diabetic residents, the nursing assistant should monitor blood glucose daily. B, inspect the feed daily. C, count carbohydrates. D, inject insulin. So the correct answer will be B, as in boy, inspect the feed daily, because patients with diabetes, if they have a small cut, it could really turn out to be really bad because they have poor wound healing because of their elevation in their blood glucose. So that's why you want to always inspect their feet daily. Make sure they don't go outside bare feet. They always have on a socks. So that's very important. It's outside of the scope of practice for a CNA to inject insulin or monitor blood glucose. That's outside the scope of practice. So, question 10, when counting a resident's respiration, it is important to A is the correct answer. Avoid telling the resident you are counting their respiration because this can alter the way they breathe. They could either hyper or hyperventilate. Question 11. Which of the following would help the resident with regular bowel movements? So we're trying to prevent constipation. Eat small frequent meals. Drinking fluids throughout the day is the correct answer. We have to encourage fluids. They have to drink at least 8 glasses of water per day. Question 12. Pressure points are defined as loose bones, bones that is close to the skin, fragile bone, weak bone. The correct answer is B as in boy, bone that is close to the skin. Question 13. Which of the following statement best describes a nurse's aide violating the Hippa law? The correct answer is C. A nurse's aide discusses resident test results with the resident visitors. So that's violating HIPAA. We can discuss patients' plan of care with nurses or healthcare providers that are directly involved in the care of the patient, but not with visitors or those who are not involved in the direct care of the patient. Question 14. The resident wears an artificial leg. When caring for this resident, the nurse's aide needs to A. Cleans the prosthetic daily. Remove the prosthetic every 2 hours. C. Observe the skin on the resident's thumb daily. D. Wash the prostheses daily. The correct answer is C as in cat. So observe the skin on the resident's thumb daily is the correct answer to this question. Question 15. A resident with dementia keeps biting her toothbrush when the nurse's aide is trying to provide mouth care. The nurse's aide should A. Record that the resident refused mouth care. B. Give the resident water to rinse her mouth. C. Check if the care plan has directions for working with this behavior. D. Ignore the resident behavior and continue oral care. Correct answer is C as in cat. That's the correct answer. Question 16. The resident has long hair that is matted. What is the best way for the nurse's aide to groom the resident hair? A. Cut out the resident matted hair. B. Brush the resident hair by straining the strokes at the scalp. C. Report to the charge nurse that the resident hair cannot be combed. D. Comb hair in small sections to remove the lower tangles. D as in David is the correct answer. Question 17. A resident spilled a cup of coffee in the hallway. Which of the following is the best action by the nurse's aide who discovered the spill? Correct answer is A as in Alpha, clean up the spill. Question 19. Nurse's aide enters the resident room and discovers that the resident is having a seizure. The resident is sitting in a chair position at the side of the bed. Which of the following should be the first respond by the nurse's aide? The correct answer is C. Lower the resident to the floor and move furniture out of the way. So our main goal is to promote safety with the resident. We have to remove any furnitures or anything that can, the patient can hit their head on, lower them to the floor, promote safety. That's the key for this question here. So thank you so much for looking at this video. Please consider